Seema, what lessons did you learn about a crisis like that and being in a position of leading CMS?
Sure. Well, I appreciate that. And the first thing I would say, we led a great effort, but it was a wonderful team that I had behind me that worked very diligently day and night on the COVID response. I think one of the biggest things that I've learned as a leader in what I'd say crisis management or crisis situation is the importance of listening and communication. You're operating in what I call the fog of war. I mean, you don't know. There was no playbook for CMS. There was no pandemic plan. One of the first things I did in January when we were hearing the reports of what was going on in Wuhan is I said, well, let's look at the plan. And it was essentially just a manual of you should have these meetings and this is how you should be structured. But there was certainly no advice, despite the fact that there was H1N1 and SARS. There was nothing about telehealth. There was nothing about the types of waivers that would be important. So we were starting from scratch. And because of that, we had to bring everybody together in the agency. And so we would have meetings sometimes once, twice a day where you had 100 people on these calls representing Medicaid and Medicare and rural health and minority health and the exchanges. And I don't know that there has ever been an effort like that where the entire agency was focused on, one particular area. So if we said we're going to do telehealth, it was like, okay, Medicaid, go back and figure out what do the states need to be able to do Medicaid, what regulations need to be changed.